Hi, I'm Bill Holland for Ministry Healthcare. Here in Stevens Point, Ministry Medical Group and Ministry St. Michael's Hospital Bariatric Program is recognized as a center of excellence in metabolic and bariatric surgery by the Surgical Review Corporation. Here now is Veronica Rieflin, LPN, who can tell us more about this comprehensive bariatric program.
Thanks, Bill. Our Centers of Excellence Bariatric Program is based on certain criteria. Here's a list of steps that may be required once you've attended an informational meeting and been contacted by a member of our staff regarding insurance coverage. Diet class and classes scheduled. Our program requires meeting with a dietitian. Our program requires a minimum of 2 dietary appointments. However, insurance companies require 3 months to 1 year of dietary classes. The dietitian will educate you on the diet you will be expected to follow after surgery. After surgery, you will have appointments with Dr. Selwyn or our physician assistant and the dietitian to ensure your lifetime success. Psychological evaluation. Psychological evaluations are required for all patients. Meeting with a psychologist ensures that you, as the patient, have the capabilities required to commit to the dietary and exercises changes, requirements that occur with weight loss surgery. Your psychological evaluation may require you to have ongoing therapy prior to surgery or throughout the surgical process. You must abide by the treatment plan provided in order to be considered a candidate for surgery. Consultation. You will be scheduled to see Dr. Selwyn shortly after attending an informational meeting. At your consultation appointment, the surgeon will review your medical history, the appointments you have completed in the process, and an in-depth explanation of the surgery you wish to have. He will also perform a brief physical examination. Be prepared to spend about 1 hour at the office at that time. Additional appointments may be made after your consultation as deemed necessary by the surgeon. Sleep evaluation. After seeing Dr. Selwyn, he may find it necessary for you to undergo a sleep study. This is an appointment with the doctor who specializes in sleep disorders. This doctor will check for the presence of sleep apnea, a serious condition that is characterized by brief interruptions in breathing during sleep. Upper endoscopy. After seeing the surgeon, he may find it necessary to perform an upper endoscopy. During this procedure, performed at the hospital, the surgeon is able to view your entire upper gastrointestinal tract through a scope. Support group. Support groups are offered in Stevens Point and Rhinelander. Upcoming dates, times, and locations are listed on mygreatreason.com. Surgery scheduled. Once our office receives a letter of approval from your insurance company and you have completed all the necessary pre-operative requirements, it is time to meet with the surgeon once again. At that time, the surgeon will explain in detail your preferred surgical procedure and its associated risks. Together, we will pick a surgery date. You will sign a consent form and register for any additional pre-surgery appointments. You will need to keep all your appointments or your surgery may be canceled or postponed. Pre-operative evaluation, history, and physical. Once your surgery is scheduled, our office will make arrangements for you to have a history and physical by your primary care provider. Your family doctor will give us the okay that you are physically ready for surgery. Pre-operative evaluation and dietary evaluation. Once again, you will meet with the dietitian to review post-operative diet requirements. Pre-operative evaluation, fitness evaluation. This evaluation is done by a physical occupational therapist. The therapist will evaluate you pre-operatively and post-operatively. He or she will establish an exercise routine that is right for you. Pre-operative pre-admissions appointment. A nurse from the hospital will call you prior to surgery to verify your medical history, medication, and answer any questions you may have prior to having surgery. Surgery. Congratulations! This is the beginning of your new journey to a new and healthier lifestyle.
Thank you, Veronica. As you've said, this is life-changing surgery, so it's good to have as much information as possible. If you'd like to learn more about Ministry's Center of Excellence Bariatrics program, go to mygreatreason.com.